So could you describe your role?
Yes, I'm chairing a meeting of health professionals to ensure that we learn from the tragic death of Sofia Galescu. So when someone dies as the result of abuse or neglect, even if it's only suspected, we meet to discuss whether we could have worked together better.
Well, this is the first one of these I've had to do, so yeah, a bit nervous, a bit sleep deprived too, new dad. But Sophia was a regular in the emergency department, unfortunately. The staff took notes, of course, and I'll be sharing those today. But Sophia didn't always stick around long enough to get help. That's not uncommon with victims of abuse or trafficking, especially when they've been intimidated by the traffickers.
I'm here to share the ambulance services records on this young woman's case. I've got the transcripts of all her 999 calls, all Sophia's calls that she made to our emergency operations centre, and I've collated her medical records, and I've gathered statements from all the staff involved. I wasn't involved in her care myself, but it does appear that Sophia mentioned having alcohol and mental health issues to our crews, who of course formally advised that she seek help from her GP. That's in the clinical records. And of course they recommended that she seek other support pathways that she could have accessed.
Sophia was registered at my practice, although mostly she saw the locum. Her appointments were sporadic, to say the least, but we saw her quite a few times over the years. My feeling is that we did everything we could for her.
Is there anything you could have done differently?
Well, that's what we're here to establish.
Ready?
Not really. I'm probably the only one here who actually knew Sophia personally. It's hard to, stay objective. Sophia had a really awful time for the last 7 years. She was trafficked from Romania, did you know that? They forced her into sex work, got her addicted to opiates, threatened her daughter's life if she tried to run away. Clearly, she needed help, but it was really hard to win her trust. I had to promise to keep everything she told me confidential. I couldn't escalate without messing up the relationship, betraying her trust. I do wonder if she'd still be alive if I told other people how vulnerable she really was.
We're dealing with grey areas here. Often it's down to communication between different services, little things like the time her daughter presented with a fever. Sophia's mother-in-law brought her in. During the checkup, the locum noticed some grazes and bruises on the girl's legs. Typical playground injuries. So there was no follow-up. But would it have raised a flag if we'd reported that to Child Social Services?
It is not about blame. Our goal is to improve practices and procedures so we can keep people safer in the future. This is a complex case. There's possible self-neglect, mental health issues, and substance abuse to consider. Sophia accessed a lot of different health services over the years, so we need to build up a chronology of those contacts. My task is to steer the group so we get as complete a picture of events as possible. Then we'll try to find out how Sophia slipped through the net so we can stop it happening again.
She was assessed as having the mental capacity to make her own decisions, and she usually refused to allow the crews to convey her to the hospital. That was a concern. It is a concern with any vulnerable patient, because the ambulance crews have so little time to make their mental capacity and risk assessments during these contacts. And they wouldn't know anything about her medical and social backgrounds either. One thing I did notice is that half of Sophia's emergency calls came from the police communications centre. She would call the police and they'd ask for ambulance assistance. And I'm hoping that we can take something useful from that.
My background is more with children's cases, but hopefully that won't mean they don't take me seriously. I certainly know enough about modern slavery to add a useful perspective. A bit too much, to be honest. I'm responsible for promoting safeguarding throughout the Acute Trust now too. New role, so whatever we learn today, I've got to make sure it gets put into practice. No pressure, eh?
I'm here to represent the Trust in this review process, and we see quite a few cases like this, I'm sorry to say. I've met with the mental health nurse who dealt with Sophia, and we reviewed his actions on the day, and whilst I'm confident that he followed procedure, I do feel a home visit to assess Sophia's living conditions and mental state might have helped prevent this young woman's tragic death. We'll discuss our findings at a formal safeguarding adults review with the other relevant local agencies in a few weeks. Thank you.